you.
Thank you, and thank you so much for having me here today. I am so immensely impressed by the leadership of the governor and the First Lady, and having all of these amazing folks in one room today to talk about recovery reinvented, addiction, and how we start to truly treat this disease in a comprehensive manner within our healthcare system, follow innovation, and make sure that we carve a new pathway into how we confront this disease nationwide. So my name is Jessica Hulsey Nickel. I started the Addiction Policy Forum just a couple years ago, but I've been in this field for a long time. Impacted family member, I took sort of the grief and the struggles that this disease had on my own family and turned that into fire in my belly, and this has been my work for my entire career. A little bit about Addiction Policy Forum, and then my fun part is I get to nerd out with you all just a little bit about some of the cool projects that we're working on. We started this to bring families and patients to the table for the first time. I was so tired of folks in recovery or folks that are impacted by addiction being sort of the token. Do you know what I'm talking about? Folks that, let me see some nods from folks that are impacted. We end up being the token, the one person that's invited to a conference or to a round table. But we belong at that table to help carve out what the solutions look like for this disease. So we have more than 4 million families, patients, folks that are affected by this disease that are a part of our network nationwide, and we're really proud of that. We also focused on this to make sure that we follow the science and we translate that science better to focus on all addiction. I have always been a little frustrated that we have a tendency to play whack-a-mole, right? We play whack-a-mole with the drug of the day. We play whack-a-mole with what the magic response is. So one year it's methamphetamines, and then we're talking about opioids, and then we're talking about alcohol. The reality is we need to focus on substance use disorders. Alcohol, opioids, methamphetamines, the drugs change, but we need to have a system in place that deals with this disease overall. We also need to make sure that we bring all of the fields together, not just one. It's not just recovery or just treatment or just education or just criminal justice or law enforcement. Not just patients or families, it's everyone around the same table making this a stronger foundation. The other sort of main focus is that we can do better. We can do better to prevent this disease from starting in the first place. We can do better to save lives. Our mission is very, very simple. We envision a world where fewer lives are lost and help exists for the millions of Americans who are impacted by this disease. And we are disruptors in this space. Not afraid of ruffling a few feathers. We need to make sure that we bring more innovation and more change so that we are at a different place in this. I got involved in this field when I was 15 years old. You could do some quick math. I'm like the youngest oldest person or the oldest youngest person in the field. I don't know which one it is, but I've spent 27 years working in this issue area. And I have been so frustrated that it sort of felt like we were at the same yard line on this field, right? We need to make sure that we, using our voices and banded together, are pushing this so we can drive better patient outcomes, we can have more support for families that are impacted by this disease, better policies, better programs, advancements, new medications, a cure. We need to keep pushing because we can have more solutions for all of our communities. So we last year released a strategic plan. It's a 4-year strategic plan that really sort of lays out some of the key components that we think are incredibly important. Helping families in crisis is number one. We are more likely in our times of crisis as family members to be taken advantage of by patient brokers and bad actors than we are to find the right physician or system or healthcare provider that we need to treat this illness. We can change that. By having better informed caregivers, there is nothing more powerful than a worried mom or dad, am I right? If we give them the right information to make sure that we are intervening earlier and changing the trajectory of how we treat this disease and catch it early, we can really make changes. Other really important areas of this, one, recovery. Having recovery support. You know, last year my grandma, who I lost this year, but she had a hip replacement surgery after she broke her hip. Now, there was very specific recovery instructions after that surgery, right? No one said, oh, well, you went in for your surgery, so you're done now. There's like a magic door sort of portal that you walk through that everything's fixed. No, there was physical therapy, there were medications, there was instructions on the do's and don'ts to make sure that she was well and that hip replacement surgery was successful. It was about 6 to 8 months of really focused, intentional recovery for her. We need to make sure that our communities of recovery have the same support that is structured around those that have the disease of addiction, a chronic illness that needs that same framework. We also focus on protecting children impacted. There are 18 million kids in this country who are impacted by parental substance use disorder. About 9 million are living in a home with at least one adult who is struggling with addiction. Another 9 million are being raised by family members, or they're in out-of-home placement through our foster care system. We need to make sure that we provide services for some of the most vulnerable in this epidemic, which is our kids. We also talk about driving discovery. We need more medications and more advancements. Every other patient advocacy group that I follow and copy shamelessly, they're always focusing on a cure and raising dollars for more medications and better technology and better treatments. We have 3 amazing medications for opioid use disorder. We have 0 medications for methamphetamine use disorder. We have 0 medications for cocaine use disorder. We need better medications for alcohol use disorder, which is the most commonly and widely misused substance drug in this country. We need to make sure that we continuously drive discovery, research, and advancements so we have more tools in our toolbox to beat this disease when it hits your family. You've heard a lot about the numbers and the statistics. Just a couple things that I want to really drive home. We lose 174 people a day, according to our 2016 CDC data. That's a plane crash every day in the country. We know from the preliminary data that number is going to get much worse when our 2017 numbers are finalized. That number increases to over 425 a day. 425 needless deaths every day when you factor in alcohol-related deaths. We know that 50% of those that are struggling with a substance use disorder today have a genetic predisposition. We pass this along to the people we love the most, right? So how do we make sure that we are making more informed decisions? We know we have a treatment access issue. About only 90% of those that have an addiction are not going to access treatment this year. Some is about treatment capacity. Others is this brain disorder, this disease, kind of tricks your brain into thinking that you don't need help, right? So it's unlike other diseases that way. So we need to make sure that we get trickier and smarter about how we engage people in the help that they need. We already talked about this, $740 billion annually that we lose to this and that we spend to this illness. So we can do better, and we are really focusing on shining a spotlight on the innovations and the amazing things that are happening in communities. I was so excited that actually First Lady Burgum was one of our Pillar of Excellence Award winners earlier this year. Because using your voice and this office and your leadership to draw a spotlight that recovery is possible and recovery is beautiful is such an important component, and we need to have more of that in every single state in this country. So when we talk about the 21 million people that have a substance use disorder today, 174 possibly increasing to as many as 200 needless deaths today to drug overdoses. Our job is really to make sure that we remember that these are real families and communities that are at the epicenter of this. We launched the 174 a day campaign back several years ago when it was only the 129 a day campaign, and then we had to relaunch it as the 144 a day campaign, and then the 174 a day campaign, and then in January I'm going to have to heartbreakingly relaunch something else because the numbers are still moving in the wrong direction. But if we work collectively together, we can change that. We can change sort of the trajectory of this overall. So this is my why. This is why I've been doing this work, why I have fire in my belly to help all families and all patients that are struggling with substance use disorder. Terry and Annette are my parents. They started struggling like most people do when they were teenagers. They also started struggling because this was several generations of addiction in our family. Alcohol use disorder was prevalent in both of their homes, early trauma, some things that were happening, and they both turned to alcohol and drugging as a way to manage that. It soon escalated to a heroin use disorder. And my dad was, He was working in his parents' TV shop by the time he was 12 and could fix anything that ran on electricity. My mom was kind and shy and loving and did not deserve the disease that struck her so hard. My dad never found his way out of this disease. He was 48 years old when he passed away, homeless, addicted to crack cocaine and heroin, struggling with his substance use disorder, and so lost. I was lucky to get him into hospice for the last couple weeks, but the damage that so many decades of addiction had done to his body was really, really difficult to watch as his daughter. My mom found recovery. She had 19 years on the path of recovery, thanks to a judge. Before there was even something called a drug court, there was a judge who gave her an option. Instead of going back to jail yet again, he gave her the option of going to treatment. And the thing that worked this time around with for my mom is that we are Native American. So this judge connected her with culturally appropriate treatment and recovery support. We're from the Sault Ste. Marie tribe of Chippewa Indians in Michigan. And so she found a culturally appropriate treatment and recovery program. And we need to make sure that when we meet people where they are, that we make sure that we're building the treatment and recovery systems that work for all different communities, because we're not all the same. And we need to really remember that as we build and expand these services. Now, my mom found that help, and we had several years of being able to rebuild our relationship and become very close. Unfortunately, addiction takes its toll, and we do not talk about the long-term health consequences of having a substance use disorder. She was 50 years old when she died of a sudden heart attack because of the consequences of several overdoses. She had a few heart problems that came out of her addiction, her active use disorder days. And I lost her way too soon to a completely preventable and treatable disease and the long-term health consequences that we don't shine a spotlight on often enough. Addiction Policy Forum is my love letter I write to her every day, right? Because we can save families, we can save lives and change the trajectory of what happens when you're struggling with this as a family. So this is a little bit connected to my mom too, and the fun part of this. This is the nerding out phase. And I am not a scientist. I'm just a regular girl who has been working in this field for a long time. But I don't know if you're with me, but when you find at the carpool pickup line, or at the water cooler at work, or if you're in a barbecue or a cookout, and you run into the folks that are about half of this country that see this as a decision, not a disease, or they see us as a moral issue. Can I get a few hands if you still run into folks that kind of are part of that old way of thinking? That's hard, right? It's difficult. And we need to help change minds and hearts by translating the science of this disease so people can understand that it is a health condition. This is a medical issue. It is a disease, not a decision. But we need to have the few little tidbits that go right after that help people understand. So if you're at that carpool pickup, I was like, oh, I don't know about that work that you do. That's, it's their decision. They did that to themselves. Our whole job and our whole purpose in this next project was to give people, all of you in this room, a few little extra tidbits that you can use to change that person's heart, right? That we need to build compassion and empathy for our patient group by better explaining the science of this. So when we first put this project together, we thought, okay, so we're gonna meet with a bunch of neuroscientists, and we're gonna meet with a bunch of our families, and then we're gonna explain this neuroscience stuff really simply and put it in a cartoon. It's gonna be awesome. We're gonna be done in 3 weeks. Well, 9 months later, we finally finished this, because it turns out most of us don't speak neuroscientists, right? So how can we get this information out? So we simplified it. We used metaphors, and we used a cartoon, and we have simple little snack packs of information that can help you change the hearts and minds at carpool pickup to the backyard barbecue. So the number one thing is addiction is a health condition, and like other diseases, it affects tissue function. You can see from these scans that look at a healthy brain on one side, and then a brain that has a cocaine use disorder, and then you look at a healthy heart, and a patient that has heart disease. You can see where that disease state is because of these amazing scans and technology we have. So taking that a step further, because of this amazing technology, this is a lot of work that Dr. Nora Volkoff did, who's the head of NIDA. We have PET scans and all these fancy imagery that really talks about which parts of the brain are impacted by having a substance use disorder. And that's your limbic system and your prefrontal cortex. Well, you say both of those words and everyone's eyes are kind of glazing over and you're ready to sort of nap before we go on our lunch break, right? So let's bring that to life for the folks that need to understand this better. Your limbic system is kind of your animal brain. It's this really deep, old place in your brain that we have in common with other species, with other animal species. This is where our brain rewards us for doing the things that we need to do to survive, whether it's eating or sleeping or drinking water, having sex, having babies, protecting our young. The things that keep our species alive is what your limbic system is going to reward you for doing. It's a powerful animal part of your brain. I have one doc that I love, calls it your lizard brain. Think of that, that's your lizard part of you. It's very sort of fundamental and hardwired. It is our survival hardwiring for who we are and how we keep our species alive. Now the prefrontal cortex, think of that as your wizard brain. That's like the smart part of you, the higher reasoning, decision-making, impulse control is gonna be in your prefrontal cortex. Addiction affects both parts of this brain, right, of our brains. And it is really important to understand how we explain that and explain how we can treat and prevent this illness in the first place. Now, what does that mean? So the limbic system, if your brain is giving you a little reward for shelter, eating and drinking, protecting our young, protecting our children, when you have a substance use disorder, your brain now thinks that the substance, right? That whether that's alcohol or opioids or cocaine or a combination, that now has inserted itself into your limbic system, thinking your brain now thinks that you need that to survive. It messes up our survival hardwiring. Now, why is this important? When we need to explain to loved ones or to law enforcement or at the carpool pickup line or policymakers why people have changed priorities and behaviors, right? When you're like, wow, I just don't understand why they're acting this way, or why can't you just stop, right? Why can't you just stop? This is why. Addiction impacts a very fundamental, powerful part of our brain, and we need to make sure that we build empathy and we can explain how that impacts behavior and priorities. Now, it doesn't all go at once, so all of a sudden you are developing a substance use disorder and your desire to drink water and protect your children and eat is off the plate. No, it happens in sequence. You start to see folks get skinny and ignoring eating, right? We notice that? Let's get some treatment folks that are in the room. But the thing that I always like to remind people of, have you seen the photos of the boy in the back seat with grandparents overdosed in the front seat? Have you seen the photos at a grocery store where someone is overdosed and there's a child nearby crying? That means that we let that illness get so bad and progress and get more severe that addiction has hijacked one of the most fundamental parts of that old part of our brain, which is taking care of our own children. This is a moment where I really came together with my mom. Addiction for us, living with my mom when I was younger, was a series of homelessness, foster care, in and out of my grandparents' house. It also meant being hungry and not being cared for, not going to school. My very first memory in this world is of scrounging up change to go find milk for my baby sister because no one was feeding her, right? My second memory in this world is of a police officer who held my hand while they put us into the back of a car because my mom got arrested with us in her care, and how kind he was, folding up the little travel umbrella stroller that we had and making sure that he found us water and some sodas and some snacks because we hadn't eaten. The thing that helped me understand my mom's addiction myself was saying that we let her illness get so severe that even her ability to care for her children, that priority, had been hijacked. So if we take the moment to have those follow-up conversations that explain addiction is a health condition, it is a disease. It is a brain disorder that affects two important parts of your brain, your limbic system, your survival hardwiring, and your cortex, which is where your thinking happens. We know that treatment works, we know that recovery is possible, and prevention is an imperative. Now, the other important part of understanding addiction is that prevention is imperative to focus on. And the thing about the prevention stuff that is sometimes so often so missed is that prevention is about delaying the onset of first use. People begin misusing alcohol, tobacco, and marijuana and as the most common substances that are misused. But it is the age at which you start using those substances that can create a sensitivity to addiction, right? We find so many more folks that are struggling with addiction, and they began using at 13, 14, so early when your brain is still developing. So here is the picture as to why age matters, right? Girl brains grow up at 22 years old. Boy brains grow up at 25 years old. Insert laughter. We all knew that boy and girl brains were a little bit different, right? Now the neuroscientists have proven it for us. We need to make sure that we do a better job of telling our kids, of telling our teachers, our educators, our parents, that your job is to protect these amazing brains while they're in development mode. When you look at a 5-year-old or a 15-year-old's brain, it's like green and orange and red with parts of yellow, and it's sort of vibrant. It is plastic and rapidly developing. And while you can learn things more easily when you are at this developmental stage, you can also hurt your brain more easily. So we need to make sure that we build in prevention as a core component, and particularly the substances that are most common for first use, alcohol, tobacco, and marijuana, that we are ensuring that folks are either abstaining from use altogether or they're delaying the onset until their brain is at a developmental stage that they're able to withstand that. The other key piece that is so important, particularly for today's topic, is recovery works, and we have brain scans to reinforce that. Right? Look at this amazing, gorgeous, recovering brain. We have a healthy person, we have someone with a methamphetamine use disorder, and then we have that methamphetamine use disorder 14 months into treatment, into recovery. The tissue function has repaired, it is getting better. And even outside of sort of the main physiological things, we learn skills, resiliency skills, life skills, coping mechanisms that are part of our recovery that can make us even healthier when we get there, right? So we need to make sure that we remind folks that prevention is imperative, that we can prevent this disease, that treatment works, and the recovery is possible. Now, very quickly, I just want to do a little bit of an overview. And by the way, the really awesome cartoon that we developed is available to download for free. And I think Paul even has some that you can take away from you at our table in the back. But we turn these into cartoons. You could do screenings, you could pass it along. It's free, it's open source, welcome to everyone. But we can build empathy and compassion for those that are struggling with this illness by simplifying the disease and the science so people can understand it better. On the advocacy side, please join us in making sure we do use our voices to fight for better resources and support. We are working with Congress right now on a package of resources and legislation for all substance use disorders. It's called the opioid package, but it's for all substance use disorders. It contains $2.8 billion in new resources to fight this disease. Everything prevention, treatments, recovery support, you name it. So we are doing our best to unite across all 50 states to bring families and patients to the table and make sure that we have more resources and that we are making this a priority. And we are so delighted that our leaders from both sides of the aisle in Congress are working with us and making this a priority. And I am so excited that this week we actually launched our North Dakota chapter. We now have 39 chapters of the Addiction Policy Forum, and by the end of the year we'll be in all 50 states, and Paul is our chair here in North Dakota. So please give him a big round of applause. So a couple things that we can do through our chapter. All of our education information, take a training, learn how to explain the science of addiction and send that out into your own communities. We have awareness events that take place frequently, almost every single month. You can sign up for advocacy alerts and get trained, so we're using our voices to fight for better resources. We can make sure that we help families in crisis. We launched the Addiction Resource Center, which is an online portal to get the right information into families and patients' hands when they need it. We also have a telehealth center that's a part of that, where we have clinicians, licensed clinicians, that can help families on their toughest days, because we need to make sure that we are intervening earlier in this illness. You know, when you're diagnosed with a, let's say, breast cancer or cancer, you don't say, oh my gosh, I hope I can find a cancer bed in Arizona and liquidate my 401k account soon enough to actually treat this, right? We treat other illnesses within our healthcare system, following disease models and best practices. It is our hope and our intention at the Addiction Policy Forum to follow that healthcare model, that disease model, to integrate the care of this disease into our healthcare systems. One of the other core components we're focusing on is what we do after an overdose. We have an emergency medicine initiative that we launched. We are putting together CME trainings for emergency physicians and ED nurses. We need to change what happens after a non-fatal overdose, right? We know that about 70% of those that we lose to an overdose had a previous non-fatal overdose. So we have an opportunity, a way to change this, to change what happens when you have your most sort of critical and at-risk patient, and we're really trying to build those resources to shore up and provide the support for all of the different subspecialties of medicine that need to have better resources. We're starting with emergency medicine, but next year focusing on primary care and pediatrics. So I think I'm a little bit over my time, but I just want to close with saying we need to innovate. We need to constantly be focusing on the things that we can do and how to change how we treat and shore up our families and patients. And we do that by all of you and the work that you do in communities and making sure we shine a spotlight on that and make sure that it's not just the sad stories and the bad statistics and the things that give us heartbreak, but the stories of innovation and progress and hope that leads our 6 o'clock news and the front page paper and can inspire us all to treat this illness differently and make sure that in 27 years from now, if it's sort of the next generation of folks doing this, we have completely transformed what happens when we treat this illness and how we recover from it. So thank you so much for having me today.